Good afternoon, ladies and gentlemen. We're just going to give it a couple more minutes to maybe get a few more participants, and then we'll get the ball rolling. Listen, are we good to get going? Perfect. Looks like we're ready to go. Just before we do get going, just want to take a moment and acknowledge the hardworking chamber staff working in the background. So we've got Kristen Walsh, our events coordinator, and the event tech for today. We've got Chantel Fisher, our membership services coordinator, Chantel Legault, marketing and special events manager, Catherine Tingley, our administrative coordinator, Caitlin Lang, policy and communications coordinator, and Lisa Kowalczyk, our executive director. All righty, here we go. So welcome to today's event. Particularly excited about this because I think this is, you know, a very important initiative today. While we're going to have a presentation on. For those of you that don't know, my name is Marcus Campbell, and I'm the current president with the Medicine District Chamber. So today, before we get going, sorry, like to acknowledge our treaty acknowledgement. So the Medicine District Chamber of Commerce acknowledges that we live and work on treaty territory. The Chamber pays respect to all Indigenous peoples and honors their past, present, and future. We recognize and respect their cultural heritages and their relationship with the land. Today, joining us from our Chamber of Commerce Board of Directors, we have Reagan Weeks, Mark Keller, and Stephen Pudwell. If I've missed anybody, they'll get over it. All righty, so it is 12:07, so I'd like to call to order today's AGM. All right, and then we have an adoption of our minutes from, or pardon me, an adoption of the agenda for today, for March 31st, 2021. Looking for a motion. Mark, did you have your hand up, Mark Keller? Yeah, there he goes. A seconder. Reagan Weeks, thank you very much. All right, so now we're looking for the adoption of the minutes from our last get together on November 19th, 2020. Wes, was that you with your hand up there? I think so. Seconder. Craig, I think I saw your finger move there. Okay. And I see Lisa's put some notes in the chat here. So if anyone wishes to make a motion, first and last name and the company in the chat. All righty. So now we're moving into our, so has everybody seen our board package that was sent out by the girls earlier today? So now we're looking for approval of our new members, and it's quite a lofty list. Really excited to see. I think there was, just pulling it up here. There's a full page worth of new members. So looking for a motion to adopt our new members.
I can make the motion to adopt new members.
Thank you, Reagan. Seconder. Mark Keller, thank you very much, Mark. Okay, so now we move into the meat of today's presentation. So I'd like to welcome Reagan Weeks, Board Director and Co-Chair of our Policy Council. Oh, we got to do the all in favor. Yes, all in favor. Thank you. Everybody gets to vote. And Kristen pulled up that wonderful list of new members. So thank you, Kristen. Okay, now back to where we were started. Presentation on mental wellness in the workplace. You know, particularly excited to hear what's going to be presented today, just because of how our community and our region has been affected as of late. So today I'd like to call on Reagan Weeks, Board of Director and Co-Chair of our Policy Council, with Sarah Cook, who unfortunately couldn't be here today, but to introduce our panelists and lead a conversation on mental health in the workplace, as it is so very important today and moving forward. Reagan, I'm going to pass things over to you.
Thank you, Marcus. And I would like to mention, I do believe Sarah is here as well. So thanks to Sarah for her work on this committee also. So good afternoon, everyone. On behalf of the Medicine Hat and District Chamber of Commerce Board of Directors, I'd like to welcome you all here to our Mental Wellness in the Workplace panel discussion. I'm Reagan Weeks, a director of the Chamber and co-chair of the Policy Council. Before we begin, I'd like to share and just give a short description of our Policy Council and explain how we develop policies. So the Policy Council evaluates issues that come forward to the Chamber of Commerce through various sources: member feedback, issue monitoring, and dialogue with the government. We then evaluate the issue and then determine whether we need to establish a task force. We seek industry experts from our membership who are willing to form a task force to clearly identify the issue, research options and opportunities, and develop key recommendations that we can then bring forward to the appropriate level of government. During this past year, our community has become so much more aware of the need to access mental health resources. As a result, a task force was assembled to develop recommendations for the provincial government. Sitting on this panel with me today, I'd like to introduce my fellow task force members. The first is Wes Patterson. He's a corporate training officer with the Faculty of Continuing Education at Medicine Hat College. He's also a certified practical kinesiologist and owner of Sedona North. Greg Goddard is a school psychologist with the Prairie Rose School Division and someone who frequently presents on mental health. You may have seen him on social media recently. Mark Keller is the executive director of advancement and community relations with the Medicine Hat College. And Lindsay Niawa, a registered nurse with a background in mental health. Lindsay's family provided the funds to start the Brandon Niawa Legacy Fund to honor her brother Brandon's memory. The task force wanted to identify how workplaces could more easily access mental health supports, as we knew there was a need for integrated, effective, and efficient mental wellness support in the workplace for Alberta business. With mental health issues and concerns present previous to COVID-19, they were further exposed and accelerated during the pandemic, costing businesses in both financial and human terms. Over a few meetings, the task force members came up with 4 recommendations. Number 1, implement an Alberta Workplace Wellness Grant to provide 2/3 of funding for mental health and wellness services for employees, employers, owners, and those who are self-employed. Explore the possibility of including mental health and wellness services within the Alberta healthcare system model. Number 3, reinstate the Alberta healthcare premium. And number 4, support a community-led, collaborative, and entrepreneurial approach for service delivery, early detection, prevention, and treatment to avoid duplication and reduce service delivery costs. So right before we get into questions for some of our panelists, I would also like to say that the Chamber of Commerce has an incredible record, our local Chamber of Commerce has an incredible record with policy advancement. I was so excited to be a part of this group because I know the team who works at our chamber makes things happen. They have brought forward other social policy related specifically to the Child Advocacy Center, and their work and their ability to break down barriers is just phenomenal. And the list of policies they have brought forward and brought to action to improve our province is really incredible. I encourage you all to check that out in the annual report. It's one of the most incredible benefits that we all get to receive from our chamber, as they really enhance the lives of everyone in our community and the province as a whole. So that's really a kudos to Lisa and her team at the chamber. They make things happen, which is why I am so excited to be a part of bringing this policy forward. So the first question for our panel, I'd like to ask of Wes Patterson. So as a corporate trainer at Medicine Hat College and as a business owner, Wes, can you explain a bit more about how you felt the Alberta Workplace Wellness Grant would allow access to mental health supports for employers and employees?
Thanks, Reagan. One of the things that we looked at when we were developing this grant is similar programs that already exist. And one of the popular programs that we utilize in corporate training is the Can Alberta Job Grant program. And so realizing that an investment in an employee benefits the individual, benefits the employer, and then out into the larger economy, we wanted to look at a proven model similar to this, but with a workplace spin. So we looked at it as an Alberta Workplace Wellness Grant would then allow, if we came up with something with a similar model, this would allow employers to find financial support and then customize mental health supports for their employees. An added benefit of this grant would also allow local health providers and entrepreneurs in the community to provide unique solutions to support the workplace and the community. So really it's going to build entrepreneurial spirit, and we see this as a win-win for the employer, the employee, and the community at large.
Thank you, Wes. Greg, as a clinician, can you speak more about the advantages of including mental health and wellness services within the Alberta Health Services model?
Yeah, you bet. So accessing mental health support from a private practitioner psychologist is costly. Currently, anyone trying to get psychological services from a private practitioner pays out of pocket. So if an employer's benefits cover you, each hour of your services cost is often only partially covered, and there's often there's typically a cap on how much can be claimed. Mental health treatment usually requires far more time and resources than is available to an employee in a given calendar year with their benefits plans. So just as one small example, one typical benefits provider in our community provides $100 per service hour for accessing psychological support. up to a maximum of $500 per calendar year. A very brief psychotherapeutic treatment plan should last between 4 and 8 one-hour sessions. And the Psychologists Association of Alberta recommends that the fee is $200 per hour. I'm talking the briefest of treatment plans. So a family accessing, say, 6 hours of psychological service with the full help of their benefits program would then be out of pocket $700 of their own money. The cost of treatment for many who need it really is a barrier to access to these much needed services. To help increase access by having psychological services within Alberta healthcare, similar to that of doctors and physicians, would help to overcome these cost barriers.
Thank you, Greg. Lisa, would you be able to speak to our third recommendation?
It's one of those things where I'm sure a lot of people have questions about in terms of asking for additional costs from government. But one of the things that we recognize through our advocacy efforts is our policies do need to be balanced, because as a chamber, of course, we're asking for cost controls by government. We're asking to ensure that they don't increase taxes on individuals and our businesses. So we always look at our policies with that context in mind, and we know there's going to be long-term cost savings associated with addressing mental health. That's proven, and we recognize that expanding some of these supports might actually create some of those additional upfront costs to the healthcare system before they start realizing some of those long-term gains. And so in order to offset that provision of that additional mental health coverage, we thought it would be a balanced and reasoned approach to reconsider reinstating the healthcare premium that the government has had in the past, obviously with exemptions considered for those under a certain income level, because we certainly don't want it to be cost prohibitive or a burden or a barrier for people within Alberta. And so, you know, ensuring that there are some of those exemptions in place for those under a certain income level so that it can be accessible by everybody. When the healthcare premium was removed in 2009, the rates were $44 per person and $88 per family per month. I'm sure, you know, when you hear Greg's information in terms of the costs for those services, if you were to pay for those out of pocket, certainly I think it's an equitable cost to consider, just to remove any potential barriers that the government would have in implementing this program. We want to ensure that we put our cards on the table. So we know in order to have these recommendations considered by government and ideally adopted, we have to also consider the government's position and particularly now their fiscal position due to COVID-19. So looking at the long term, as the government realizes these savings, that cost could be considered, reconsidered, obviously, in terms of the reduction to overall long-term healthcare costs within our province. So that's the justification and kind of the reasoning behind that recommendation in particular.
Thanks, Lisa. Mark, in your role as the Director of College Advancement and Community Relations, you look at broader community collaboration. Can you speak about the importance of our community working together on this issue?
Absolutely, Reagan, thank you. I think we all recognize that wellness is something that we all need and that every workplace needs. And if people take the few minutes to read the policy background, I think we'll discover that wellness does make strong business sense. But at the same time, not every person and not every organization has the knowledge, skills, and resources to make wellness activity the priority it needs to be. It becomes pretty clear that improving individual wellness will take collective effort. Health professionals have a role, government has a role, educators have a role. We all must play a role to address what is really a complex issue. And we also have to acknowledge, I think, that as individuals, we need to be part of the solution. So when you have that many players and that many different roles, there will be complexity, but we can do a good job together. And it's also assuring to know that the work we do can be measured. again, tracking back to the research that goes behind the policy, employers will discover that productivity and retention are improvable. There are business reasons to focus on wellness. Our health professionals will be able to track referrals and preventative measures. Governments can measure the success of grant programs that we hope come into place. It's important at the same time, though, to remember that the ultimate impact that we're looking for is the wellness of our friends and neighbors. It truly is something we're collaborating on, and we're looking for solutions for our community. So Reagan, thanks.
I'd like to extend a thank you to our task force members for volunteering their time and expertise and helping us build a policy that we are already using in our advocacy to the government. I'd now like to shift the focus from the task force to some of our local businesses who are already investing in the wellness of their employees, and to also the Canadian Mental Health Association in Medicine Hat. And they're here to share a little bit about the work they're doing that speaks to exactly what Mark was talking about previously, looking after each other in our community. So first, I'd like to introduce Brienne from the Canadian Mental Health Association. We received valuable information from this organization when we were developing and researching our policy. Could you speak about the work CMHA does and what resources are available to employers and employees in our region?
Absolutely. So CMHA, we function under 3 pillars: education, support, and referral. Under education, we are able to provide free trainings to the community. We generally keep them between 1 and 3 hours in length. So we can cover topics that affect wellness. So we cover things like stress, coping with stressors, understanding suicide, how to interact with suicide in our friends and family, how to recognize the signs and symptoms of mental health problems, and when to get people help. Any of these presentations are available for free to businesses within the region, and they can all be adjusted as well to fit the needs of the organization as they come up for people. So if you have staff members that are struggling significantly right now with, say, COVID stress, we were able to kind of adapt one of our presentations to help target that specifically for your staff. We also offer workshops. Those do come at a bit of a cost. They include Assist and Safe Talk, which are intervention / recognition of suicide in our friends and family. These workshops are available to the general community, but they're also available to businesses and organizations within the region. We can book one specifically for your organization, and we could potentially do that at a reduced rate as well as far as cost goes. Under the support pillar, we offer a wide variety of support groups, both virtual and in person, to our businesses and our partners out there. So for more information on those kinds of things and what we have to offer as far as education and support goes, we can be reached. Oh, no, that's the wrong way. Right there. That's our phone number, 403-504-1811. Right now, we also have the availability of some funds to go into counseling for individuals who've experienced a loss to suicide. So the Suicide Bereavement Subsidy Fund is up and running. We can provide 6 sessions with a counselor of somebody's choice if they fit into the criteria of having a loss to suicide. More information about that program can be found on our website, which is www.mentalwellnessmatters.ca. Ultimately, though, we want to be there for our community partners as we all kind of navigate these tough times with COVID and all of the losses and the mental health concerns that we've had. We encourage people to reach out to us if they want education or if they need support or if they need help, perhaps knowing where to go to get further supports. So that's kind of a brief overview of everything we have to offer.
Thank you for that great information.
Yeah, thank you for having me.
I now want to introduce 2 members who have implemented workplace wellness programs to demonstrate some of the ways that mental health can be prioritized and addressed in practical ways at work. The first is Michelle Amos. She is the Human Resources Manager at Methanex. Michelle, can you let us know what steps Methanex has taken to look after employees' mental health?
Thanks, Reagan. Last year, our employees were impacted by the suicides in the spring and summer of 2020, as well as the stresses from COVID-19 and our planned plant shutdown. In my role as HR manager, I made some phone calls to various people, one of them being Brienne Mellon at Canadian Mental Health. And I invited Brienne to come on our site for a pop-up booth while we had over 900 workers on site. You can see the picture on the screen. This was scheduled in September for World Suicide Prevention Day. She brought lots of information, brochures, leaflets with her that we have since used on notice boards, toolbox talks, and she shared with us the Buddy Up awareness program, which is specifically aimed at men. In addition, Methanex paid for a counsellor to come from Keys to Hope Counselling to be on site for the afternoon and opened that up to anyone who wanted to go talk to that counsellor in confidence. Both Brienne and the counsellor were received extremely well by our staff, who provided feedback to us that they wanted to hear more about mental health information and awareness raising from the management team. So we started sharing information about mental health in things like our staff newsletters. We carried out some mini surveys, and we offered some of Brienne's Canadian mental health free training sessions. We knew that there was an appetite from our employee group to raise awareness and start talking more about mental health. From this, organically, a small group of employees got together and we started a mental health committee. This committee meets once a month for an hour to focus on sharing a specific topic with the rest of the employee group. My role as management sponsor is really important to make sure that there is leadership commitment to any kind of committee or activities around mental health. The committee have some very simple goals, ensuring that our employees have access to and awareness of mental health information that's out there, providing a safe and confidential space for employees to talk about their mental health, and trying to reduce the stigma of mental health by building that awareness and continually talking about it. As chamber members or business owners, you can start small. You can do things like accessing the community help phone list from Canadian Mental Health, or the very excellent Harvard Business Review article, What to Do When an Employee Discloses a Mental Health Condition, with your people leaders so that they know how to respond appropriately when an employee speaks up and says that they have some mental health concerns. I would just encourage you to start small, tailor your support and information to your company's values and the way that you do business, and use your existing communication channels that your employees are already familiar with. Thanks very much, Reagan.
Thank you, Michelle. That was a very helpful presentation. I'm interested in learning more about the Buddy Up awareness program. Do you know where people can find out more information about that?
I'm going to defer to Brienne, as it's a Canadian mental health initiative. Over to Brienne.
Sure. So the Buddy Up program is actually run by the Center for Suicide Prevention based out of Calgary. They're gearing up for their next campaign run. So if you wanted more information or to get connected with those individuals, please reach out to us at 403-504-1811, and we can connect you up with the Center for Suicide Prevention and provide that bridging.
Okay, thank you, Brienne and Michelle. And I really appreciate Michelle's tip to start small. So there are things we can do this afternoon to begin to support everyone through this. So thank you, Michelle. Next, I'd like to hear from Peter Donnelly. He is the president of CanCarb. Peter, first, I want to thank you for your generous support of this virtual event. Our advocacy work is only possible because of members' support. Can you speak about why CanCarb has prioritized mental health and what steps your company has taken to help employees?
Thanks very much, Reagan. I just want to say thanks to Michelle for her information. That was very helpful, and I got some good tips from that myself. So obviously the reason why we're doing this is just because of all of the things that everybody has mentioned already. But there's 5 initiatives or sort of actions that we have taken at CanCarb that I can speak to. And of course, these are all just an attempt to ensure the overall well-being of all of our employees. So the first is that we now make continual mention of mental health at our weekly or monthly or employee town hall or safety meetings. We're not just talking about PPE anymore, but we just give reminders to employees to focus on all aspects of their health, including their mental health. And as Michelle said, this just helps to raise awareness and keeps the topic front and center for everyone. The second is that last year we signed up for a 24/7 employee family assistance plan, which is provided by a company called Humanicare out of Ontario. And you might think that that is expensive, but in fact it's not. It's only $2.12 per employee per month. So it's really only, it's $170 of cost for, and that covers for our 80 employees. So it's a very reasonable cost for that. But it provides a significant benefit because there is counseling that is offered for many types of things such as stress management and bereavement and depression and so on. The third is that we have, like many companies, we have $1,000 of annual coverage for psychological counseling for each employee through our main insurance provider, Manulife. But this is in addition to coverage for other services such as chiropractic or physio. The fourth is something that I'm actually very excited about, is that we just recently signed up for an employee wellness coaching service provided by a small company called Apex Performance. And their focus is on the physical well-being and nutrition and positive behavior changes for employees. And each employee is entitled to 2 hours per month with the wellness coaches one-on-one. And they also provide services such as a weekly online yoga class. Again, it's a very it's not a high cost service at all, very reasonable. And in fact, it's provided by some graduates of Medicine Hat College. And then the final thing is that we make financial contributions to specifically support local mental health service providers, such as Bridges Counseling, for example. And we make sure that our employees are aware of this so that they know of these services in the community, but also so that they know that their employer is supporting them. And you know, it helps, I think, the employees to feel proud that their employer is supporting these local service providers. So those are the 5 specific efforts towards mental health support that we have in CanCarb right now. Reagan?
Thank you, Peter. More wonderful suggestions for all of our workplaces. The Apex Performance was really an interesting idea and initiative that I haven't heard of before. So congratulations for launching that. And specifically, I would like to thank both Peter and Michelle for being leaders in this work and for sharing with all of us at the Chamber the work that they're doing to advance wellness in our community. So very, very grateful for that. We'd now like to give an opportunity for any of our participants to ask questions, and we would just encourage you to type them in the Q&A if you'd like to hear from any of our panelists. As we're waiting to see if anyone has a question from the audience, I'll maybe ask Wes, as someone who has experience with both training grants and as a business owner in the health and wellness field, can you speak a bit more about the benefits and challenges when it comes to programs like the Canada-Alberta Jobs Grant?
Yes, so one of the biggest issues that we had with the Canada-Alberta Job Grant program was the application process. So it's evolved over the years. It used to have to be, you had to print out paper documents, have everyone sign, get the training approved, and then it would take about a month to hear back. And so it wasn't really quick turnaround for time, and that since then they've gone to digital applications, so it's improved in that way. And most recently, as of February 18th, they've actually made some substantial changes. The government has addressed a lot of the red tape reduction concerns that myself and a number of our clients have put forward. So for example, like some of the new changes, there's a temporary for the next year where business owners, so sole proprietors, business owners of smaller companies, so 4 or less employees, can actually now take advantage of training that didn't exist in the past. Another change that they've just recently done as of February 18th is they've allowed family members. So before, if you had a family member working for your business, they couldn't access training support. So they've added that in. And now once the application gets in online, you can begin training right away. So operationally, they've changed it and made it more user friendly. So now people aren't having to have that month wait before they could sign up for training programs. So we would like to see a model similar to this for wellness, understanding businesses have been hit hard, and having a model like this would allow a lot of small to medium-sized businesses that see struggling employees, see struggling themselves. Now they're going to be able to apply for this. They're going to have an idea of what might work for their staff. So it might be something of a gym membership. It might be bringing in someone to do yoga. It might be a combination of nutrition. It might be doing some workshops, whatever that is for them. They could present that model forward on the application, submit that, and then if approved, if similar to the Canada Alberta Job Grant program, get up to 2/3 of that reimbursed. So that would really cut down their costs and allow them to provide that wellness support to their employees, to themselves. And we just think that would be spread out exponentially in the community. So if they really did address the model and follow the changes they've made as of February 18th, that would go a long way towards a grant adoption like this throughout the province.
Thank you, Wes. We do have a couple of questions from our audience. So I'd like to offer the first. It's from Jen Boschman, who's asking, Michelle, can you discuss any problems you faced in trying to launch a mental health committee at Methanex and how you were able to establish buy-in?
I think that's an excellent question. It's definitely about having management and leadership support. You have to be committed to this in your business strategy. You have to have the data to ensure that you can sort of demonstrate the value to the organization. For buy-in, to be honest, there was very little pushback. This was very welcomed by the employee group. We started small and we got a lot of instant feedback that could we see more activities, could we share more information. So we took baby steps and the feedback was instantaneous. So the buy-in was there straight away.
Thanks, Michelle. So we've just got 2 more questions and then we will be thanking our panel and moving on with our agenda today. I'm conscious of time and I know you're all on your lunch hour. So our next question comes from Shauna. For CanCarb, was Humanicare a standalone EAP or are they an extension of the group benefit plan?
Thank you, Reagan. Humanicare is a completely standalone from the group benefit plan. It's a separate company and completely standalone from Manulife. Thank you.
Thank you, Peter. Our last question today, and then I think I will hand it over to Lisa to close it off, is from Arnie, and he is saying, hello team, how much do you think the cost involves roughly per worker the company should include in their budget for mental wellness? Any suggestions?
Reagan, I'm happy to start with that one. There's an awful lot of things that you can do that are actually free of charge, really small things. I think it depends on what strategy you're going to take, what kind of work environment you have, what your current communication channels are. So using things like notice boards for posters, if you have any kind of team talks, utilizing Brienne and the resources available at Canadian Mental Health. I do think there's lots of things that you can do that are really low cost or no cost. And then if you see that uptake from employees, again, working with the likes of Brienne, or if you have a benefit provider, a lot of those can be discounted or already subsidized. So the cost can be from very low to minimal. And again, I would suggest starting small and seeing what the uptake is.
Thanks, Michelle. There is a question from Kinetic in the chat, and I'll ask Brienne, would you mind answering that in the chat? Because I know your answer to that is yes. And I'm going to turn it over to Lisa now to close us off and talk a little bit in her closing remarks about a possible insurance plan that could be helpful.
Thank you so much, Reagan, and thank you for your work in sharing this task force and bringing these panelists together. And thank you to each one of you for participating in the task force, for contributing to today's event. We value that insight and expertise so much as a chamber. We are truly a grassroots organization, and we do rely on the feet on the ground, boots on the ground, insight and involvement to really inform our positions and allow us to do the work on your behalf and be able to serve our community in this way. So thank you to each one of you for the extraordinary work that you do each and every day. I did want to tap into Peter's comments on the employee assistance program. I think that is hugely valuable. And while I recognize that, sometimes there isn't, certainly, and to Greg's comments, there isn't enough coverage for the support, the fulsome support that's needed. But through even our own Chambers Group Insurance Plan, which is, the #1 plan in Canada for small businesses, they have an employee assistance program that is built within the plan. And so if you don't have a health and dental plan, or if your plan doesn't have an employee assistance program built in it, or counseling services, I do highly recommend that you take a look at what your benefits do currently provide. I certainly know that pre-COVID, I'm sure not as many employees were accessing the employee assistance program, and perhaps employers weren't even aware that their benefits include an employee assistance program as part of their benefits. So it's a really good time to review your benefits and what your benefits do provide to your employees so that you can communicate that. I know I often will communicate with our team that, make sure you use your benefits. We pay for them. So you need to make sure you're accessing them, but sometimes they're, your team, your employees won't fully know what they have covered. So it's a good idea to do, even, if you haven't done it for a while, certainly take the opportunity to review the benefits that your employees have, review the plan yourself, make sure it has the coverage that you as employers want to have for your employees. There's also lots of flexibility in different plans in terms of customization. And I would also recommend that you kind of do an annual review, have your, if you work with a certain benefit provider, have them come in and do a presentation, particularly for companies who have larger employees. If you have staff turnover, sometimes it's not always top of mind to review those benefits and make sure people actually have the details of those plans, but kind of build that into your plan. The other thing that we've recognized, even within our own organization and working remotely, is the disconnect that COVID has caused and working remotely. So just looking at ways to keep your teams connected, even if that's informally, building in a portion in your work day where your team can connect for those non-work related conversations, doing, if it's an employee mental health check, just to see how everybody is doing, what pain points and emerging issues are coming up. But I appreciate all the tips that each of you have shared, and ways that we can encourage the conversations around mental health in our own workplaces. And as employers, making sure that not only are you taking care of the mental health of your employees, but also ensuring that you get the supports that you need as an employer as well, because we know, certainly from a chamber perspective, we've heard your stories and we hear you, and we recognize the challenges that this has created. So thank you. I'm going to turn it back over to Marcus for a few of our updates from the chamber.
Thank you, Lisa, and thank you again to everybody that presented today. The one thing that I got out of today's presentations is that, mental health and depression and addiction and all the other things that come with it, it doesn't seem to discriminate. It seems to take advantage of all different walks of life out there. And I think this is a great step in the right direction, starting the conversation. So thank you again. And Peter, thank you to you and your team at CanCarb for sponsoring today's event. We're a little strapped for time, so I'm going to rip through the remainder of the stuff pretty quickly. So chamber updates, strategic planning. So our team, along with Lisa and her team, well, the whole chamber team, we just went through a couple of days of strategic planning, and it was quite a, you know, we're normally used to doing this in person and spitballing ideas, but we did it virtually and did it through a really neat platform. And out of that, we established 4 main goals, 10 primary objectives, with over 40 initiatives to drive the chamber forward to aligning our future framework. So connection, support, and influence continue to be the pillars of the chamber mission for the organization, with 4 primary goals moving forward. So number 1 is to influence regional collaboration. Note the word regional. And opportunities through the strength of our network. 2, to be a connector and a resource hub for all businesses. 3, to cultivate greater awareness and recognition of the credibility, value proposition, and brand of the business network. And 4, to increase connections with our business community and create greater awareness of services offered. So out of all of that, you know, came a little bit of our vision is that we're extremely proud to be a grassroots, non-for-profit business network built by business for business. And we look forward to serving our community with a renewed plan in place. Policy updates. So we adopted 3 new provincial policies, which will be presented at the upcoming ACC AGM. And just a little side note, today's presentation is not an AGM. I made that wrong. I misspoke. This is just a general meeting of our policy council. So Lisa, you can correct those notes. AGM and policy session at the end of May. The 3 policies that we're taking forward is what we're here for today: increasing access to mental wellness workplace supports. The second one is equitable funding for air ambulance service, so the good people at Halo, and expediting approval of grazing lease applications. We're currently working on a federal agricultural policy as well to best support smart farms, pardon me, for the future. Work integrated learning, sent out a student business matchmaking email. We got a great response from that with businesses that are looking to hire short-term projects, students for short-term projects. The deadline for applications for the wage subsidy has been extended to April 15th. I know that I personally have taken advantage of the wage subsidy, so excellent opportunity that benefits both the business and the students. If you're interested in getting your application and getting matched with a student, Chantel Legault is our go-to team member with the chamber team. So if you got questions or concerns regarding this, please reach out to Chantel Legault. Events in the workplace, Membership 101, social media conference, municipal election, and our business awards. We've got the hang, you know, we're getting pretty good at this, or not we, or me. Lisa and her team is getting pretty good at the hosting of virtual events. So we've got a full lineup of events that we're currently coordinating. Keep an eye out in your email inboxes for invites, and make sure you visit the Chamber events calendar for all the upcoming programs on the website. We want to remind everybody that nominations for our business awards are open. A great opportunity to recognize some of our local businesses and entrepreneurs. Make sure you take some time to recognize those deserving businesses and support our local business heroes. For local first and Shop YXH, still a huge focus for us, promoting the local first and encouraging our community to support our local businesses. More so now than ever before. When they buy, contract, and look for services from suppliers, always a good idea to look locally. As an extension of this initiative, we've partnered in delivering the Shop YXH platform as a local online marketplace. Lisa, I'm going to hand it over to you now for Chamber Resources and Communication.
much, Marcus. You can follow along in the chat as our team posts some of the resources and links in there. So you can click through to find out about our events, to nominate a business, shop YXH, and I'm sure Chantel Fisher, our membership services coordinator, will post a local first, where you can actually download your local first decal and promote that even in your own business. We continue to use our website to get information out to you. Our COVID-19 information page is still being updated when new information becomes available. So you can go to medicinehatchamber.com/COVID-19. We do a weekly update. For those of you who followed us in the early days of this pandemic, we were doing daily updates. We had transitioned those to weekly updates just to make it a little bit more sustainable. So Friday mornings, you can hop onto our website and get all the government news locally, provincially, and federally in one place so that you don't have to look for it. And if you are tuning out some of the news media and some of the noise out there, at least you can get your news in one place without any of the added editorial that sometimes goes along with it, and just protecting our own mental health. There's certainly, if you go to our COVID-19 page, we do have community resources on there. So lots of times we refer to that page, obviously, for business supports and funding and templates and pandemic plans, but it also has an area for community resources, call center numbers, and of course, you can still get the links to the government resources and guidelines and that kind of thing as well. If you don't subscribe to our weekly newsletter, definitely ensure that you go onto our website. If you go to our publications page and stay connected with us, you can get that weekly right to your inbox, so you don't have to go looking for it. And of course, we're always interested in hearing from you. What issues you're facing, what resources you would feel are valuable, or resources that you can't find that you would like. We're always building out our business resource library, and so we want to ensure that we are always here to help and connect you to the resources that you need. Certainly, as we continue through into our recovery, and we're very much focused on recovery while still supporting those businesses right now, we continue to advocate to government, particularly for clarity in the information. We know that's been difficult in trying to understand the basis for decisions and some of those data points. Certainly stressing the need for workplace mental health support. So after this policy was adopted, we did send a letter to Premier Kenney and copied a few of the ministers to emphasize the need for clarity, the importance of mental health supports, and of course, ensuring that there's still the proper financial mechanisms in place for the businesses that continue to need that support. The budget is coming out, federal budget is coming out April 19th, so we'll be watching that as well closely. And we have weekly calls with our chamber network, and we are always ensuring that we're keeping our community top of mind locally, provincially, and federally. And while you may not see it on a day-to-day basis, like a duck on water, we're scrambling underneath, just making sure that we're covering all of our community needs and working on your behalf, even when you don't see it on the surface. So ensure that you do connect with us if you do need supports or information. We're going to be releasing a new report within the next week, and it's entitled The Economic Impacts, Challenges and Opportunities in a Post-COVID Economy. Is based on, for those of you who participated in our survey from September to December. Will showcase the results of that, as well as economic initiatives and specific actions that our community can take, both as business support organizations, government, and individual businesses as we move forward into recovery. So we're quite excited for the release of that. And that actually, the report, a lot of businesses question how it ties into some of the other surveys and research that's done. Of course, it does tie into the Brood report, the Business Retention, Expansion, and Workforce Development that was done pre-COVID and is complementary to that, taking in the context of the COVID impacts. And it also is complementary to the Regional Vitality Action Plan. So it's bringing all of these reports together and looking at how we can accelerate our community forward. So on that note, just know that our team is here to help with our new strategic plan. We're looking at ways to enhance our value to you and to ensure that our organization remains sustainable and thriving in this community moving forward, and that we can continue to grow and build our community up, and knowing certainly that we're going to emerge from this pandemic stronger and more resilient than ever. So I'll turn it back to you, Marcus.
Thanks, Lisa. So now we move into roundtable discussion, which I think we're a little tight on time. So if you have any new issues that you wish the chamber to look at, similar to our mental health policy, or any other ideas, thoughts, opinions, we'd love to hear from you. So just reach out through the website and get in touch with the ladies of the chamber. Our community is going to come out of this thriving and stronger. I think in the end, this is going to make us all better. Announcements. Make sure you register for our membership 101 on April 13th, and I believe Chantel's involved with that. And then various dates for our employer information sessions, student wage subsidy programs located on our event calendar at medicinehatchamber.com. And look at that. We got 1 minute left and we're getting out of here. Again, thank you very much to everybody that participated today. Certainly a great topic, and I hope that, you know, I got some key small ideas out of it that I can implement even with my own team. And don't be afraid to reach out and talk to people. We're moving in the right direction. So with that, Lisa and everyone, I will move to adjourn our meeting.